During this crisis across the state of Ohio, people are doing some amazing things. And I've asked Fran to share some of those things that she knows people are doing, and also talk a little bit about what people can do at home, what they can do with their kids during this period of time. Fran?
Thank you. It's so good to be here. You know, I do see people really coming together and wanting to help, and we're all in this together. I had a group of women who actually are making face masks in their homes, their own personal PPEs, and they're making them out of cloth. And I'll just show you a couple. These are not what our hospitals need, but they can help people in other areas and just to keep the germs to themselves. This is a couple that were made, kind of simple ones. General Harris's wife sent me a pattern for one of them, and she made this one to show me. And so we have a group of women all over the state, really, that are making these and sending them out to people where they're needed. So they can also help you, I think, if you have, they can help you keep your germs to yourself and help you to keep your own PPE. If you have one, keep it clean by putting this on the outside. So that's just one little thing that a lot of people are trying to do. It's kind of a frustrating time for me because I like to be with my grandkids and I'm trying to keep my distance from them. But I've been dropping off little gift packs to them of craft stuff so that they can make some crafts and we can make it together. And it's been a lot of fun for us to see what they've made. This morning I dropped off a package that had things to make caterpillars, some finger paint, that they can make handprints, can make the Very Hungry Caterpillar, and some clothespins with tissue paper so that they can make butterflies. Because next week I'm going to read that book, The Very Hungry Caterpillar, to the kids, and I want to see what my own grandkids can make. But we've had a lot of fun as a family actually sharing our pictures and you know, the kids are sharing them on Zoom and FaceTime, and watching my little granddaughters do TikTok every day, a little different dance, and so that's been a lot of fun for us. And of course, there's still writing letters. Everybody can write letters, and Mike's got a couple of letters from the kids, and it's really been fun. We can still sign up for the Ohio Governor's Imagination Library. Last week when I talked about it, I think since then we had about 4,000 people sign up. Now remember, it's going to take about 8 weeks until you get your first book. And it may take a little longer than that because a lot of this is done by volunteers. But you can go on to ohioimaginationlibrary.org, sign up for the books. It's available almost everywhere in Ohio. This is a book in the mail every single month from the time a child is born until they turn 5 years old. So sign your kids up. And I've been making lots of recipes. Actually, today I'm going to post 2 recipes that I made for soup. One of them is for black bean soup. You know, if you went to the food bank or something, or if you bought a lot of beans, this is kind of an easy recipe that takes 3 cans of black beans and lots of good seasonings. And so it's a very delicious. I made it for Mike and I for dinner last night. It's very good. I'm also posting a recipe for Tina Husted's mother's Italian soup. It was in the cookbook that Tina and I did together for the election, and it's a fun recipe. It actually, in her recipe, she uses Bob Evans sausage. I didn't have Bob Evans sausage, but I had some Steve Evans sausage, so I substituted that. I didn't have tomato juice, but I substituted a can of tomatoes as well as a can of Rotel tomatoes to give it a little spice. And so all these recipes, you know, you can use what you have. You know, we don't have to follow a recipe exactly, especially if it's something like a soup. So use what you have and kind of come up with new flavors. And I think, you know, what we really have to think about is the memories we're making for our kids. How is this going to be remembered? The virus how's this going to be remembered in 10 or 20 years? And you know, if you ask us, we're going to talk about the anxiety and stress and how hard we worked and to help prevent this. But what will our children say? You know, are they going to say, this is the time that I got to spend so much time with my mom and my dad, and we read books together, and we cooked together, and we just had all sorts of great memories. I have one grandson who's decided to cook his way through my cookbooks, and he's had some real successes. The banana bread was really good. Yesterday he tried to make Buckeyes. They were a little sticky, he said, and he needs a little more training on that. But think about what it's going to be like for these kids. Is this going to be a special time for them? If it's a birthday party, I saw on Facebook one family that they called all the kids that were supposed to come to the birthday party, and they drove by and honked and gave birthday wishes just from the car. You know, are we going to think of creative things like that to do? You know, so I think we have to think of this as a time that we have to do extra special things with our kids to make it really good. Thank you.
So in the spirit of things to come after we get through this, I wore my baseball tie today. Tomorrow, which would have been opening day, I'm going to wear my Reds tie, and the day after I'm going to wear an Indians tie. So things to come. We will play baseball again, and we just got to all hang in there and get through this. People are doing, as Fran said, a lot of great things across Ohio. I recently spoke to a number of businessmen and women on the phone, and I thank them for all the different things that they were doing for this effort. But I did ask them to do more, and I'll just give one example. Cincinnati-based Procter & Gamble CEO David Taylor is an example of a leader in a company that really stepped up. About staying at home, specifically aimed at our younger folks. P&G helped engage a very popular person on a very popular social media platform. 15-year-old Charlie DeMello has 40 million followers on TikTok. That's the most followers of anyone on TikTok. She created an original dance on TikTok last night, I'm told, at 10:45, and here it is. Here's Charlie. Stay at home is the message. All right. It had 95,000 views in 10 minutes. In about 10 hours, it went up to 6 million views. So that's quite amazing. And because of P&G's leadership through this social media effort, we're helping spread the message, the stay-at-home message, to all the people of Ohio and across the country. Now others in Ohio and around our country are copying Charlie's dance, posting their own video doing the dance with this dance challenge on TikTok called #DistanceDance, Distance Dance. For the first 3 million videos posted, which happened, I'm told, in a matter of hours, P&G provides hygiene, health, and cleaning products to families in need. And they're doing this through Feeding America and a group that Fran and I are very, very familiar with down in Cincinnati, Matthew 25 Ministries. So we thank Charlie and we thank P&G. I'm also proud of Ohio's higher education, businesses, healthcare sectors who are working together at really very fast speed, doing everything they can to help us ramp up for the expected surge of people who will need care as they experience the coronavirus. We do not have, and you've heard us say this many, many times, and you've heard it on the national news as well, PPE, personal protective equipment. These are masks, these are goggles, gloves, gowns, face shields, other things. We did get our share from the Strategic National Stockpile, but it's simply not enough, and we know that. That's why we've ordered elective surgeries to be postponed. We've even ordered, as I've announced, veterinarians not do elective surgeries, dentists not do elective surgeries. We know that this will make a difference. It'll make more of these available, and we'll not use them up. We're also appreciative of other businesses sharing their PPE, also our tremendous career and tech schools, construction businesses, others. They are taking those that they have and turning them over so that we will have those and we will be ready when this surge hits. So to all of you who are doing this, thank you very, very much. If there are any of you out there that can add to this, we will certainly appreciate it. We truly, truly are all in this together. Let me thank the members of the Ohio Congressional Delegation. I know that both John and I have been talking to them, Democrat and Republicans, as they put together a third package. That package, as we heard, passed overnight. We thank them for doing that. Expanding unemployment assistance, helping individuals, aid to hospitals, food aid, small business loans, transportation assistance are just some of the many things that we know that we need, and we're very grateful for the members of our Ohio delegation for working on these things. Let me also thank the members of the General Assembly who are in session today. We made requests to the General Assembly. The bill that is working its way through the General Assembly appears to have all those things in it, so I want to thank the members very, very much. The Senate has passed the bill. The House, I believe, will take the bill up later this afternoon. Let me thank Senate President Larry Obhoff. We appreciate his leadership. Senate Minority Leader Kenny Yuko as well. I want to also express my thanks to the Speaker, Larry Householder, and Minority Leader Amelia Sykes. To all of them and to all the members of the General Assembly, we thank you. We have a long way to go, but this is your action today is certainly very, very helpful. Helps us move forward as we all deal with this crisis together. Let me just now turn it over to Dr. Amy Acton. Amy, if you can give your report for the day.
And good afternoon, everyone. I come to you today after spending the morning at our Emergency Operating Center. That's really the hub of incident command for our public health and statewide response. You're going to be potentially seeing me coming from there in days to come as we really focus in on our response going forward. So stay tuned for that. But I'd like to start out, as I always do, with some of our data, and we can go ahead and pull up our numbers. But I'll start first of all by sharing with you that we do have 704 cases at this point. We know that that is, again, the tip of the iceberg for us because our testing is still so limited. The age range for that still is from February 7th through March 25th. I'm sorry, the date range of onset to stopping the start of symptoms. But the age range is from under 1 to 94. I just want to note for the media, there was a mistake. A lab had reported out a wrong age yesterday. I had said 95, but I'm told they made a correction at one of the labs. So it is under age 1 to 94 with a median age of 51. The age distribution is fascinating to me, and I'll cover that in a slide here in a second. But we do know that some folks had asked about the sex differentiation, and it's getting a little more close now as we have more numbers, 333 females to 371 males. So that's about 47% females, 53% males. So it's getting closer as we get better data. 182 hospitalized, 75 in the ICU. and long-term care facilities that are hospitalized is 24, healthcare workers, 116 healthcare workers in that batch of cases. So I say all that to say we now also are reporting 10 deaths in the state of Ohio. That data is actually coming to you at an earlier time. We're moving the time we report the data. We made those final numbers today at around 11 a.m. and we're trying to move that reporting time sooner. Stay tuned because we are going to be doing, through our website, more real-time data reporting. We're also going to have a lot more interactive graphs on our website. I am following the media to see what questions you're asking or what data you're interested in. And again, I appreciate that because it causes us to rethink some things and try to get that to you. It might take a day or two to get all that to you, but let's take a look. Let's go back to the first graph, if you might, of what we have. So this will remain, and again, will be on our website by counties. And somebody asked, are we reporting this every day? Our county data, will be reporting it pretty soon. It'll be interactive, but it's still, we're in well over half our counties, moving toward 3/4 of our counties now. But some of that, again, has some error in it. I just have to always add an asterisk to our data as we learn more each day. It's reported sometimes by where they were tested and not where they live. And you can see the rise in cases. So we went up by 140 cases since our last reporting, and we reported earlier today. So we'll see a big leap tomorrow. Next slide. Again, just letting you know again, 704 people total tested. This is a new number for us. We've been wrangling, trying to see, we have so many testing sites between hospitals, private labs, and our public ODH lab. We know now that 14,764 as of today have been tested. We're still having trouble on the negative numbers. People are wanting to know how many negatives. I've seen roughly in some areas a 5% positive test, but I don't have enough data to give you a firm on that yet. And again, healthcare workers is an interesting one because we know they're higher risk. We're also testing them more because they are in that high-risk group. So we do know that 16% of the cases being healthcare workers. Next slide. Another interesting thing we're following is how many have been hospitalized versus not. Remember, I've told you that most of us won't be hospitalized. But we are seeing approximately, over 20% right now with our data being hospitalized. And of the hospitalized, a good percentage, over half being in an ICU unit, needing more intensive care. So 11% of our total cases right now requiring ICU. ICU is what we're going to be following in the days to come. It's really important because all of this, all the work you're doing, and all of what the actions we're taking are to take the pressure off of our healthcare system and our ICUs. We know that we're going to need to double the amount of capacity that we have in ICUs in the data to come, and that's work I'll be sharing with you soon. Next slide. Yeah, the age range to me is a little bit fascinating. We know that 70% of our cases are going to be over the age of 40. What's interesting, and I think we're seeing this around the country, is you're seeing that middle age group. Early on, and certainly in China's experience, it was really skewing older. I do want everyone to know that young people do get sick. Middle-aged folks, people a little bit over middle age like myself, get sick from this. We do tend to recover more, which is great news, but in our cases, remember I told you even in the 40 to 50-year-old age range, it can be very dangerous to get 1 in 250 is fatality rate in the 40 to 50-year-old age group. So I really want us all to take this seriously and just pay attention to this age range shifting in our country. Next slide. This is an interesting, we're also going to share with you data about our call center. I have to tell you, this is, I'm so proud of the call center. This is our, 8334 Ask ODH. It did have a huge spike in calls. There are a lot of people asking questions, and the Lieutenant Governor will talk about this, about essential businesses. It's important. This call center is really not a legal aid center, and we've had a lot of calls, and unfortunately, We can't answer detailed questions. It's really something the Lieutenant Governor will talk to you about. We don't really have that capability to help you understand your workplace situation. We really want you to be working with your employer on that. But there is a lot of information on our website, so if you get hung up when there's a lag time in answering the call, please do go to coronavirus.ohio.gov. That'll also be a great resource for you. And I believe that's for our slides. I have a few more things I do want to share. First of all, you know, this is a shutdown, but I want you to think about it as an open up. This is a time we're going through some really unprecedented things, and I do need you to stay home. It's sunny out. You can go for that walk with your dog, walk apart from people, but this is more serious than ever. We're entering a difficult time. But I want to give a little shout out, first of all, to Ruby Owens. Ruby is 9 years old, and she wanted to write a letter to me. This has reached me, and I want you to know a couple things. First of all, sometimes I feel that I don't really deserve all this attention I'm getting. I am one person at a point in time, and there's a lot of serendipity that brought me to the good fortune of working for the most amazing governor and First Lady and the Lieutenant Governor. You know, sometimes when you look back on your life, it all adds up, but at the time it doesn't make sense. I can tell you it is. But just like our data of cases is the tip of the iceberg, I am the tip of an iceberg of some amazing colleagues of mine, cabinet members, and really public servants. It is our job to do this for you. And I am the tip of the iceberg of a huge amount of folks who've been working for over 2 months, 24/7 on your behalf, and they will keep working for you all through this. So please know, it's not me, it's all of us. I am just that little tip talking to you right now. But Ruby, I want to tell you this. Ruby said, she's 9 years old, she's at home with her little brother. I had a little brother growing up, and to her mom as well. She said, I'm happy you see a bright future for us. And I want to tell you, Ruby, not only do I see a bright future for us, I see a bright right now for us. I think the First Lady really eloquently said it. You know, this is going to be a time we look back on, and it's forcing us to slow down and see things in a different way and observe things differently. A really big role model I'm one of those reading geeks. My bedside is stacked with books, some half read, some I'm halfway through, but one of the biggest influences on me early on was a man by the name of Joseph Campbell, who wrote A Hero with 1,000 Faces and A Hero's Journey. He really studied all world mythologies and religions, and he really talked about some of these times that you're in when it feels a little bit like entering the dark woods. It's also the foreground of great wonder, and I've seen that time and time again. Every day I'm having a hard day, right in the middle of the hard thing is the gem of the innovation that's going to become the next great thing we do. And I want to say to you, Ruby, in your interest in STEM, I'm really proud of you, and I'm really proud of all the young people at home. I want you and all of you at home to don your cape, don that cape, keep being a force for good, and keep staying home, spreading the word, and doing the good acts that were shared with you. So thank you, Ruby.
John?
Great. Thank you, Governor. Thank you, Amy and Fran. Right now, my daughters are at home. They get their science lesson from Amy at these 2 o'clock briefings when they're doing homeschooling. They do the home ec portion of it that Fran talked about with cooking, and I know I talked to my wife last night, and she was talking about what a gift this is, an unexpected gift that they're getting to bond and grow closer together as moms and daughters, and I hope that's happening for your family in these very difficult times. I know that the governor touched on this a little bit. It's worth reiterating. We appreciate the members of Congress that are working to get this final legislation passed for us. I know the Senate worked on it. The House is going to work on it. The relief that's in that package is incredibly important for us to do what we need to do to serve the people of our state and nation. I will also add a reiteration of what the governor said about thanking the legislature. A lot of the things in that package that they're in the process of completing today will give us the tools we need to better serve you, including some of the licensure extensions that I know many business people have been asking for. One of the things that we heard from people in the healthcare supply chain and in the food supply chain is that they needed more drivers to be able to and to make sure that they're delivering packages on time. We received notice today from the U.S. Department of Transportation that they're cutting what we'll call some of the red tape that stands in the way of obtaining and renewing commercial driver's licenses. For these delivery of these supplies. You can find out more information on this if this affects you at coronavirus.ohio.gov/businesshelp. So that information is available for you there. I know the Trucking Association was really important to them that they got that done, and we're there with you on this. Also adding for utility assistance, typically the Home Energy Assistance Program that the federal government Home Energy Assistance Program runs from until the end of March. We have the ability now to run that program until May the 1st, so that income eligible Ohioans have access to that funding to provide them energy, heating assistance. That's also available for further information at coronavirus.ohio.gov/business-help. Oh, also worth mentioning, I know a couple days ago we had trouble with the unemployment website. The team worked diligently to get that fixed. It was up and running all day yesterday. It's been running so far today without any problems at unemployment. That unemployment site, unemployment.ohio.gov, is available for you to use. Now, something that I know that the governor and I and Dr. Acton, we get a lot of questions on as it relates to the stay-at-home order, and in particular, the essential business component. We get a lot of questions, and we ask you to just simply read the order. It's on the website at coronavirus.ohio.gov, and it's under the tab Director's Stay-at-Home Order. You need to use your own good judgment of the plain reading of that order to make your determinations. It's worth reiterating again. Businesses, you do not need a letter, a certification, or a clearance of any kind that would come from us or be issued to you by anyone else. But it is recommended that you create a document with the justifications on how you deem yourself as an essential business and how you are following the Safe Workplace Order, which is item number 18 in that order. It's incredibly important for you to go through that checklist to make sure that you're providing a safe workplace. In a conversation the governor and I had with mayors and this morning, they reiterated the need to make sure that you do not call the police, law enforcement, or the health department to ask them to interpret this document for you. They are in charge of enforcement. They cannot interpret it for you. Okay, so that's the way that this is being administered. Dr. Acton talked about the hotline that we have. If you call the hotline, they should give you the same exact guidance that I am giving you today. We've asked them to do that. We're trying to make sure that we're being clear about what you do under this order. If you're a business, be prepared. Have that documentation ready. It'll make your life easier to provide the rationale, because if you're violating this, you will get called on it, either by a competitor, an employer, a neighbor. Somebody will call you out, and you need to make sure that you're doing this the right way so that you can justify your operations, because we will, through this process, need to be fair. In fair, we need to hold everybody accountable to be fair, and that's what the goal of what we're trying to do is all about. Again, please read the order. Make sure that you follow the criteria that's in that order. Remember that if you're an essential business, you have to follow the safe guidelines. I want to reiterate this. And understand, whether you're a business that's under the essential order or not, these safe workplace guidelines are going to be with us for a long time. Even when we begin to come out of this, we are still going to need you to create a safe work environment. So if you think this is just going to go on for 2 weeks and then we're not going to have to create a safe work environment, that's not the case. The safe work environment standards are going to last for a while as we come out of the situation that we're in with the stay-at-home order and essential businesses. So please prepare yourself. Remember why we ask you to do this. It's to slow the spread. We don't want to overwhelm the hospital system. We want to respect our fellow Ohioans and make sure that we're not getting them ill. As it's been said many times, we're all in this together. The virus can't spread unless we spread it, so we all got to do our part to slow the spread. Governor?
Thanks. I'll be happy to take questions.
Governor Giamatti from WHIO-TV, thanks for being with us. Are you aware, Governor, this is a question about that unemployment benefit sign-up process. As late as today, people are still calling us at our television station, still emailing us, texting us every way known to mankind, getting the message across that they cannot get on the website correctly, that they cannot get through on the telephone correctly. They are angry, they're frustrated, they're a little scared, frankly. They can't get through. Number one, your reaction. Number two, what can you do about it? You say this is fixed, is it? Because those messages came to us as late as just before noontime today.
Well, we're certainly sorry about that. We apologize for that. As John indicated, we're doing absolutely everything we can to keep it up, keep it going. John, you have the figures. You want to repeat how many are coming in? It's been, as you can imagine, it's been a massive influx of people who, need this help.
Yeah, there were over 400,000 contacts through the website yesterday of people seeking information. And I understand there are a variety of things that go into this. We have problems at the local level, perhaps where the person is connecting in. We have problems at the site where the website is. But the team reassures me that they're putting every effort into this that they can. We are working overtime at it. We're bringing every human capability that we have to the technology that's available. We are truly sorry if somebody is having trouble due to the technology or due to any human error in that chain. But I ask for patience. This is, we're going to make this available to you. We're doing everything we can to bring the resources to bear to solve this problem. I ask you to know that we are empathetic to your situation. This message is being received and heard, and as soon as we walk out of here, I will be on this again, as I have been every day since we started this.
Kevin Landers, WBNS 10 TV. This question could be for either the governor or for the lieutenant governor. Daycares are continuing to force parents to pay even though they're shutting down. Are daycares eligible for small business loans and unemployment? And does the pandemic daycare license include those who have in-home childcare? And for Dr. Atkin, the 116 healthcare workers that tested positive, is that a function of workers who were sick and then came to work, or did they get infected while working with patients? And if they're using PPEs, how did they come in contact with it? Thank you.
Let me start. One of the things that we have done with daycare is, because this is only temporary and we want to keep the capacity there, is we have the ability now to be paying daycare to actually stay there and be ready when they reopen again. John, you want to take the other part?
Which part of the question?
We got three questions.
Yeah.
So the question was, are daycares eligible for small business loans and unemployment? And does the pandemic daycare license include those who have home child care?
The answer, whether a daycare worker certainly would be eligible for unemployment. There's no doubt about that. And as a small business, they would be eligible for small business assistance, disaster assistance.
Amy?
So the question was about the healthcare workers of that percentage. I don't have a breakdown on the actual histories of the healthcare workers. I do think The hospitals are working with their staff. They have to take their temperatures coming in. There's a lot of processes and procedures, and they're supposed to report any sign of illness right away. But also, you know, we have had healthcare workers who didn't know that someone had it before, and in that original first days, I think there was some of that going on. There are also healthcare workers in long-term care facilities. So we have a lot of guidance going out. The most important thing folks can do at home is before you interact with anyone, before you go to see a private doctor, if you're not doing it by telemedicine, before you go to an emergency room, if you can call first, that is a great thing that we all can do as citizens to let them know. And then there are a lot of processes in place to minimize that at hospitals. Thank you.
Good afternoon, Governor. Randy Ludlow with the Columbus Dispatch. The Controlling Board today released millions of federal dollars to local health departments. But still, is that going to be enough money? The state also has a history of poor funding of emergency health preparedness. In fact, the state money in that program was cut 4% this fiscal year. Do we need to take a longer-term look at how we fund both state and local health departments?
Yes. You know, Randy, I've said many times that we've got to focus a lot more on public health. In Ohio, we have the state health department, but we also have 113 local departments. And so we've just, not just in Ohio, but we've historically in this country underfunded public health. And I think one of the lessons from this pandemic, and when it's done and we look back and what are the lessons learned, what do we have to do differently, one of the things that's going to be very, very clear is we're all going to say, it's not going to be Democrat or Republican, there's going to be a consensus. We've got to fund consistently year after year public health and do a much better job. As I've indicated, I think, to you and others, when I picked Dr. Acton, it was a very conscious decision. And what I wanted to make sure we did is to, number one, begin to emphasize public health more. At the same time, I realized that if you looked at the issues facing the state and the challenges facing the state, so many of them, from drug addiction to mental health to other health problems, so many of them are intertwined with health and so many of the challenges that we face. And so I want someone who could be a spokesperson, someone who is articulate and can talk directly to the people of the state. I had no idea, obviously, that we were going to end up with this and that Dr. Acton was going to be on TV every day at 2 o'clock. But that was my focus on public health. And what Dr. Acton has been working on for the last 13, 14 months since she took that position is to build up public health around the state and build it up from the state's perspective as well as local. So absolutely, we have to invest more, and we have to do it consistently year after year.
Okay, one more quick question, you'll be rid of me. Are you aware of any confirmed or suspected cases in adult or juvenile prisons?
I am not, no. No, I'm not.
Hi, Governor. Julie Carr-Smythe from the Associated Press. I just had a question on the order with regard to essential businesses. It sounds as if the local health departments and local law enforcement and now the call center are being really inundated with questions about this. Could you talk a little bit about why you decided not to be more specific, not to itemize the kinds of businesses you were speaking of in that order?
Well, I'll start the answer. John was directly involved in writing it. There's a limit to how specific you can be, because if you say a certain business, then the question is, well, what actually is that business doing within that? Or are they involved in something that is, in fact, essential? Then you get into the other question, are they involved in the chain that leads into that business? So we basically followed what Homeland Security put forward and what they outlined. It was adopted by Illinois. It's been adopted by other states. It seemed to be the more uniform. We're trying to get something that's uniform, not just in Ohio, but in other states. So that's why we came up with what we did. But it's like anything, like a lot of things in life, it's fact specific. And you've got to drill down and look at what the facts are. And if you just do it by category, or if you try to get too specific, then you're really going to be misleading people. And what we've asked people to do is look at it and look, they should start by the assumption the business is closed. But then there's significant exceptions in there, and they're written in there so we can continue to eat, so we can continue to live, and just conscious decisions were made about who could be open. I will tell you, before I turn to John, we're starting to take action today against a company, and it will not be, I suspect it will not be the last company, where people who clearly cannot function or not come under the category of essential or staying in business, we can't have that. Look, we hope everybody's back in business shortly, but we also know this thing is not going to even peak, we don't think, until May 1. So I don't want to mislead anybody. This is not going to occur overnight. We have got to slow this thing down, and the only way we slow it down is through the distancing, the physical distancing is probably a better way of saying it than social distancing. We want people to stay connected, but we want to physically separate people. And so that's the only way that this is going to take place, and people, we need everybody to do this. John?
Yeah, Julie, you know, this is a difficult one because you're relying on people to follow this order, and the reason that we base this on the best available information from people who've worked on this issue through the Department of Homeland Security, also realizing the limited resources that we have to enforce it. We tried to write it plainly, recognizing that the supply chain is a difficult thing to define. You may make, for example, pallets or cardboard boxes, and someone say, well, that's not part of the essential supply chain. Well, if you're putting food in it, if you're putting medical supplies in it, if you're putting other things in it, well, it's certainly an essential part of the supply chain. It's impossible to get that deep into the definition and to write something like that out in a very short period of time. So we used the Homeland Security CISA form as guidance. We talked with the Ohio business community across the board, from large to small businesses, to try to provide as much clarification as we could. And we've been working with our local officials to try to get the enforcement right. The one thing that's in our order that I haven't seen in any other state's orders is the item 18 piece about how businesses have to operate. They must apply the safety health standards that are in that order, or they are subject to closure, even if they are an essential business. And I want to emphasize this again, because as Dr. Acton will often emphasize, that getting this mostly right is really helpful. If businesses, if we can isolate the number of people who are interacting only to essential interactions, and any of those interactions are healthy at a social or physical distance, taking all the precautions to wash hands, to clean surfaces, to not create congregations of people, then we will have a dramatic impact in driving down the spread. And that's what we're all after. We're trying to find that balance between what we need to be healthy and safe to slow the spread so we don't overwhelm our hospital system, our healthcare system, and that we provide the basic infrastructure in the economy that's necessary to serve people. It's not an easy balance. This was an informed decision based on Homeland Security and talking with the business community and the enforcement community about how it could work. And we will continue to provide guidance on it, but enforcement is coming. We can't have people who are violating this because it's not fair. We're not trying to crack down on anybody, but it's not fair for one business to do the right thing in one industry sector and another business in that industry sector not to do the right thing. So the enforcement is out there.
Thank you.
Hi, everyone. This is Molly Martinez with Spectrum News. I have a viewer question today from Michael Lawrence. He says he is the development director of a homeless shelter, the only emergency homeless shelter in Lake County. He's wondering what the plan is. He says he's in charge of 50 people a night, sort of in the same room. Will funding be unlocked to help the homeless, and sort of what is the plan for them?
Well, it's clearly a problem when you have that many people together. But you also can't just turn them out. So we are working on that, and we'll have more coming. But it is a unique challenge, Amy.
Yeah, Molly, I just want to add to that. One of my colleagues, as I said, we have a whole host of me, and Director Lori Chris and a few others have taken on this mantle. You know, this is one of my closest topics, and all the people I know in the field have been reaching out. You know, it's been very hard for homeless people with medical conditions, ongoing. This has been an ongoing thing we were fighting to address in our communities. And so that is definitely top of mind. All of the social determinants of health, what our nonprofit communities are doing, that is all coming to bear. And as we go through these days, we'll be, as soon as we have a standard policy or something we can share with you or best practices, we are doing that. But there's a ton of behind the scenes work by some of the most amazing people and leaders in the field. Thank you. Thanks.
Good afternoon, everybody. I'm Ben Schwartz from WCPO in Cincinnati. Governor DeWine, I know you and your administration have explained the actions you've taken as they've come, but now with where we're at now, I'm wondering if you can speak on the early kind of drastic actions you took compared to other governors and even the federal government, and what led you to that and how you feel about them today.
Well, all our decisions have really been based on the best information that we could get. I will tell you, throughout my career in public service, as I look back on it, the biggest mistakes I've made have come about because I didn't get enough facts. I didn't drill down deeply enough. I didn't ask enough questions. I didn't ask the right people. And so we saw this coming, as everybody did, and you know, I started asking the questions. I've got, as you can see, I've got an amazing director of health. We also put together a group of 14 doctors around the state of Ohio who we call upon to get advice from. In addition to that, we reach out beyond Ohio to doctors and people who are doing the modeling, experts on pandemics. So we're gathering all this information as we could get it, and the decisions we made were really based on that. You know, I think the essential job of government is to protect people, particularly the most vulnerable. And so these decisions, I'm not going to say they were easy, but they were decisions that we made based upon how do we protect people's lives, and how do we set Ohio up for the future. The first, I guess, big decision we made had to do with the Arnold Classic here in Columbus. And, you know, look, this is a huge impact on the economy in central Ohio. But we worked with the mayor. Mayor Ginther was great. His health director was great. It was a real partnership with us, and we went through this and tried to examine, you know, what's the downside, what's the upside. We know what the upside is, but what happens if this takes place? And we just consulted people and came to the conclusion that having 60,000 people from 80 as spectators, 60,000 people in a relatively small area for 4 straight days from 80 countries made absolutely no sense in regard to what we knew was coming. And so, you know, that was a tough decision. But we look back on that now, and I think, gee, that was kind of almost like a no-brainer. That was not a, you know, shouldn't have been a hard decision, but it was the first decision we made, and we were, you know, out there, and I don't know that anybody else had closed much around the country. So, that always makes it a little more difficult too. But that's kind of what goes into our process. And, again, what we try to do is reach out and talk to the best people we can find. In the last 24 hours since we were here, I've been on the phone with different people, governors and others, talking about, how are we going to expand the capacity of our hospitals. And our hospitals are planning and they're working, but we also have to make sure that we coordinate this from the state level, because we want, no matter where you live, whether you're in Monroe County or Noble County or Vinton County or wherever you live, we want you to have access. If you come down with this, we want you to be able to have access, and then if you get worse, we need for you to be able to go into one of the larger hospitals. So again, that's just pulling all the information we can, finding out, getting everybody's ideas, and then coming up with a plan, and that's kind of how we do it.
Thank you.
Thank you.
Tom Bosco with ABC6 here in Columbus. Is there any thought being given, or is there any relief available for people who are self-employed, contractors, people who would get a 1099, those kind of people? Of course, there are small business loans, but what about for some of those people who don't really own their own business but are more contract workers? Availability for unemployment for them at all?
Well, again, the unemployment, since most of those folks do not pay into it, they don't get it. But we also know they're out there hurting, and with some federal dollars, we may be able to add them as well. I know John's worked on it. You got anything else, John?
A couple of points here on unemployment compensation. The package that's moving through the Congress right now would have some relief for those those 1099 business owners, small business people, self-employed. So we don't know the details around that. The bill hasn't completely been finalized yet, but we will seek those details and be prepared to implement it as soon as we can. I want to touch on the issue regarding our unemployment compensation system, because when I got the question from Jim Oddie that it hadn't been running, I was very disturbed by that. I've immediately texted the director right from here, and she has assured me that all day today that system has been up and running. There have been no shutdowns of it. So unemployment.ohio.gov is up and running, where you can apply for unemployment, and she assures me that there have been no failures of the system today.
That's one of the big questions we're getting from our viewers, is about the unemployment system. But back to the 1099 workers, I know you just said you have no details. Any idea if that looks like a one-time check or something like that?
I wouldn't want to speculate on that, because one of the things what we really try to do is to give things that are accurate, and I wouldn't want to speculate and create a false expectation. We'll get that we'll get that out to you as soon as we know it.
Thanks.
Isaac Dreyer from WHIZ News. This is actually a question for Dr. Acton. Hi. This is about the numbers reporting that you were talking about, the effort to create more and more possibly real-time number reporting. Do you know if those numbers will become available via like a digital API or something like that for private aggregators or somebody that's interested in taking information from Ohio and other states?
Yeah, eventually, and we have a big data warehouse. We're actually part of something called Innovate Ohio, which is this really amazing data lake and platform. We've been an early adopter of that, set about 70 data sets loose for researchers and the public this year. And so as we sort through this, there will eventually, and I'm not sure all what is available now, but public data sets available. We have a lot to learn from what we're doing here, and eventually there'll be, as I mentioned before, a whole post-mortem or a after action. And so a lot of other researchers I know would love to look at some of this data. So I'll give you more up on that. I want to tell you that we've brought, we're working with people all over the country, even over the world. But we have, within Ohio, this group of data scientists, data analytics, and modelers, both on the health side, but also on the health economic side, and then the general economic side. There's a group of them getting together, And I've even told them to reach out to some of the media folks who really love numbers too. But I have a nickname for them now. I'm calling them the Force. Because we ended a call once and the modeler said, "May the force be with you." And being of a certain age, I guess that's all ages now, I'm calling them the Force. So,
Thank you.
Yeah.
Adrienne Robbins, NBC4, and I have a couple questions for Dr. Acton. One being the numbers you talk about are healthcare workers and the percentage of the cases we're seeing from them. Is there a certain percentage or a number of healthcare workers where you're going to be concerned about the level of care that people will be able to get? And I was wondering too, if you could just clarify, a lot of people are making masks and it's great to see them wanting to help. Can people actually use those masks, or should they be spending their time doing other things?
Yeah. So I want to, first of all, start with the first. Healthcare workers, our frontline responders, they are precious to us right now. And remember, most of us will get sick. Healthcare workers will go home and be around their kids who might have been exposed, or someone in their family might have traveled. So we'll expect that a certain amount of healthcare workers will get sick. Again, like the 80% of us stay at home. That's the most important thing, is that they're honest about it, and they stay at home and they recover and get back in. And from a workforce issue, we are looking, that's more to come in the days to come. I will talk to you about how we're expanding our workforce from, retired people. We have a medical corps. Each state has one. We have retired Ohio Department of Health workers. We are redeploying student nurses, med students, and others. We're creating a new amateur epi force that we will train up just-in-time training. So staffing is going to be an issue. If we're talking about, needing to, by 50 to 100%, increase our ICU capacity, it's not just beds, like a physical bed in the buildings that we're going to be talking about in the days to come, but it's the people who man that. It's the doctors, and maybe the doctors who might be doing more of an elective surgery will now be redeployed and taught the things they need to be on the front line. So it is a massive moving puzzle piece of staffing that I'm thinking about. Now, the masks are fascinating to me. I've told you, this is an unprecedented time for us. And I want to be honest with people at home. We are going to be, when we don't have enough PPE, we are going by the old playbooks, the old but true things. And that includes, in war situations when you've seen people use bandanas. The CDC actually has guidance on using all sorts of things to protect yourself. We're not to that stage for the frontline healthcare worker doing an invasive procedure, but we are conserving. Hospitals have a lot going on right now to conserve. But wearing a mask, like you see in places like Asia, where it is actually common courtesy, when people are sick, they actually wear a mask so that they're not spreading those respiratory droplets. And that works. That mesh is not going to keep out like an N95, a microscopic virus, from coming in, but will certainly protect someone from sneezing on someone else. And so masks will play a role, and I think we'll see them used in clever ways. And so I really applaud the efforts of people who are, again, each and every one of us can do some part of this massive puzzle piece. And I'm glad that we have folks already working on that here. And we have industry already working on masks. And we have industry working on sterilizing masks with steam and UV. So there's all sorts of innovation happening. Thank you.
And then a quick question for the Lieutenant Governor. With the Senate bill, obviously absentee voting is looking like it will be a smaller window than originally the Governor and the Secretary of State wanted to see. As a former Secretary of State, do you believe that's enough time for voters?
Well, we would prefer a longer period of time. We think that a longer period of time would have been better for the voters of the state of Ohio, but the legislature is decided on a shorter period of time. I've spoken with the Secretary of State. I know that he has some concerns about that, but we will make the best of it. There will be a 30-day window, which will be a similar time window of what they would have normally had. Secretary is going to try to do some things to supplement to make sure that everybody who wants to cast a ballot does, but there's no doubt we would have hoped for a longer period of time.
Thank you.
Spencer Hickey with Hannon News Service for Dr. Acton. Could you talk about the significance of so many tests coming back negative, and do you know how Ohio's 16% being healthcare workers compares to other states?
I can tell you that we don't have strong data to talk about negatives yet, but we do know that, it is, remember, flu and RSV season. So I think a lot of people that are high risk, they were being ruled out for a lot of those at once. So you might have people who tested, looked like it, and definitely fit the high risk category, but potentially had something else. So we're really being judicious in the use of those tests. So my guess is, as time has gone on, the shortage became more apparent. You'll see a tightening of that and probably an effect on the numbers. And I'm sorry, your second question
was on, do you know how many percentages of the people who have it are in other states are healthcare workers versus Ohio's 16%, you said?
We have not, and again, all of this data I'm giving you now has a big asterisk of, our N, our number, that our data is so slim. A matter of fact, some of the projections I would like to have the answers to now, I just feel like would not be even responsible to do. But, so this is just giving us a sense right now. Looking to other states, it really depends. It would really depend on, are they using the same sort of criteria we are? We know that all states have scarce resources in terms of testing. So stay tuned. This data, which we'll be using to drive so much in the months and even years to come, will get a lot stronger for us once we have widespread testing available. Thank you.
You don't know when there'd be widespread testing available, do you, since you just mentioned that?
So, we know that there are several components in the testing chain that are in low supply. There's so much that goes into doing the tests. There are reagents that are used to do the tests. That's what we didn't have in the beginning and made us the second to last state to be able to get testing due to 2 failed reagents. We know there are a shortage of some of those and new test techniques being invented. As you hear from the White House, there are a lot of new types of testing coming into being in the country. But there are also shortages of swabs, shortages of test kits. And so there are many components to that puzzle. We have people working on acquiring or making all those components, but you need to have all of them to be able to make this work. And so it's a tricky game right now in testing.
Laura Hancock with Cleveland.com. Dr. Acton, when there were 2 community spread confirmations, you had estimated maybe around 100,000 Ohioans had COVID-19. Today, with a lot more infections, what is the best estimate you can give?
So I do apologize. I did confuse a couple things I said in that sentence, but what I was trying to say to folks is a couple of things. One was, I was absolutely certain we had community spread, and I felt we'd had it for a while. And I think if you go back to my tape on the timeline and everything, it sort of talks about that. And then our data is really showing the symptom onset. So I think what you're seeing in the United States is the fact that the farther you get from the initial start in Asia, you saw that intensity in Wuhan and then the spread throughout the country. The more time and the more travel and the way this disease has spread, sort of the countries that are coming on later often have it seeded throughout, and then you're seeing those spikes. So even in Ohio, we won't see one Wuhan, we'll see multiple. And so I was trying to make the understanding that I was very convinced we had community spread, and even though we didn't have the testing, I was already seeing that. Now, the 1% number actually came for me, and I did go through the math before, but it came from working backwards from what we knew at that time, which is 40 to 70% of all of us will get this virus in the course of a year. Those numbers, I've seen 56% in one study, and that's varying, but that is the best of science at the time. And I also knew when we would start to peak. And so we actually looked at some modeling that others were doing, and we sort of worked our way back to say, and my point was, if I wait till 1% of my population has this, I will be acting way too late. And when I said 100,000, that was my trying to put into language for people. We have 11.7 million people in Ohio, and I was taking a guess at 1% is roughly 100,000, really 117,000. But I didn't want to wait. I knew in time to come. We'll never know the exact numbers until we look back. Thank you.
Okay, thanks.
Yeah. It's a lot of math.
Hi, everyone. Andy Chow with Ohio Public Radio and Television, State House News Bureau. I think this question's more for Governor Mike DeWine. Governor, you addressed this about a week ago, the idea of evictions, but since then there have been, sweeping stay-at-home order. Have you given any more thought to calling for a moratorium on evictions?
Yes, I've certainly thought about that. Don't have any announcement yet today, but we'll have something.
I guess if you don't want to go into specifics, do you have any message for people who are not?
I mean, look, many people are already making the conscious decision. You've got bankers, for example, who are making the conscious decision to work out something. People who can't pay, small business who can't pay, people who have met their mortgage all along, now they can't. Same way with homeowners. So, we all are all in this together. The fact that someone cannot pay now should not reflect on their credit or the character or anything else. It reflects on the situation that we are all in. So we certainly would ask people not to do that. One of the challenges is making a complete stop on evictions. Is that evictions can be for things other than not payment. So you could dream up a horror story and why someone really needs to get someone out of a place. But as far as not being able to pay their rent, people have been able to pay their rent. We certainly would hope people would hold off on that.
Thank you.
Good afternoon, Laura Bischoff, Dayton Daily News. I was listening to the podcast, The Daily, produced by the New York Times the other day, and they did an interview with a doctor from Italy who was talking about how in Italy, because they had such a huge spike in the number of cases, that they had to kind of change the criteria for considering which patients get access to the limited resources. I'm wondering, have Ohio hospitals, Ohio healthcare policy experts, have you started those discussions? Is it up to each hospital? How's that going to go down?
Yeah, let me just first say that's what scares us. It's one of the things that scares us. It's one of the things we're trying to prepare for. One of the reasons we closed schools. We did all these other things, and that still may happen. But we're doing everything we can to avoid that, and that's why we're asking Ohioans to follow the orders, follow suggestions, do everything that they can so we can slow this thing down. We've got to slow it down. We can't have that spike like that. Dr. Acton?
Yeah. So, Laura, this is, the thing that is keeping me awake at night. And we have to learn from Italy. That's why every day and every person matters. You've got to stay at home, and we've got to slow down and stop the spread. We know it will eventually spread, but when we slow it down and we do the things, I am absolutely convinced we always had community spread, and I'm absolutely convinced that our governor is making the right moves, because we really don't want to see even what New York and others have had to face already, and certainly what Italy is having to face. And believe me, Italy has a wonderful healthcare system, so we should not doubt that it's some other country that doesn't have a great healthcare system. I've studied health systems all over the world. I should tell you that this is something the CDC does have guidance on. The Institute of Medicine has published on this. And as far back as 2016, my health department and then Governor John Kasich had looked at these issues under the context of Ebola. So there is, in the world of health preparedness, an ongoing dialogue about this. These are ethical, difficult decisions. They're being held, these conversations are held collectively. We absolutely plan for every scenario. We work from the worst case and try to get ourselves back away from that. And so, but those are things that are ongoing discussions. Those will be things that we do address more in a collective way. And it's really, really important that we have those hard ethical conversations so that we're never hit in a situation with one individual on one front line having to be all alone in that circumstance. And I really hope, again, everyone, in my seriousness about this, everything we're all doing, every essential business, every non-essential business, all of these things really will make a difference in this outcome. Thank you.
Just for clarification, does that mean that the collective way, is that on a national level or on a statewide level?
Absolutely. You know, we will all live this as the spike comes at us, as we face the higher parts of that curve. We're going to do it a little lopsided at different times in different parts of the country. But as the governor has said, our best estimates, and these are still estimates, on the curve are, you know, mid-May, late April, mid-May. Those estimates are changing. What we do changes that. What we do changes it. And we all hope for a drug that works, maybe on treatment, or, you know, something might happen that changes that. But of course, the big one that will ultimately change it is vaccination, which is far away, a year to a year and a half. And so these conversations are happening, like I said, at the Institute of Medicine and the CDC. They've happened way before this pandemic and pandemic planning. They are conversations we have to have as a society and as a United States of America. Thank you.
Thanks.
This is Jackie Borchert from the Cincinnati Enquirer, and I've been told I'm the last question of the day. So I'll start by, again, thanking you all for continuing these briefings every day. I know a lot of people are watching at home, and we in the State House Press Corps really appreciate you making your time for us. I just want to go back to the number that you gave today, Dr. Acton, about 5% positive. And I've already seen some instant reaction to that since we are testing the most high risk and vulnerable, that maybe that is low, that maybe this isn't as prevalent in Ohio as we thought, or as dangerous. Can you, what should Ohioans take away from that number today?
You know, I really, don't want anyone to make any conclusions from that number. We know that 40 to 70% of us are going to get it. We might not all have it now. We might have it in the weeks to come. It's very poorly understood at this point who got tested and who didn't in those early days. As you know, the government rolled out testing to initially public health laboratories, and we had a pretty good sense of what that group was, and we were following the CDC sort of person under investigation definition. But there was a lot of changes that happened very rapidly. As we know, this is a rapidly evolving situation. And so when the private labs went on and we had hospitals get the capacity to test, some of those definitions were looser, so that we don't know. And ultimately we'll know when we can go back, when we have widespread testing, first of all, widespread surveillance and sentinel surveillance, which is sort of checking pockets that are asymptomatic, but also serologic testing, which I'm really looking forward to having, because we'll actually be able to go look backwards and see maybe who had it and had antibodies develop, but we didn't actually know it at the time, because there are people who had this who never were tested, and like we know, we can't test most people, they're staying at home, have it, and we're assuming they have it. So those numbers aren't super helpful, but I just wanted to give an inkling of one. This came from one batch of testing, but I always hesitate to give those numbers because I feel like you can't draw a ton yet. I wanted to say thank you for this, and you know what I mean.
I just want to clarify that last bit that you were talking about looking back. At what point will we be able to do that?
We will be looking back at this for years and years. There will be history books written. This truly is that once in a generation, every 100-year experience, and we're going to learn so much as a country. We're going to be learning so much more in times to come, and this data will be analyzed by 1 million people. There'll be a lot of armchair quarterbacking. As you can see, there's already so much out there, but I can tell you I feel very good about the actions we've taken here in Ohio. Thank you.
Thank you.
Well, thank you all very much for joining us again this afternoon. We'll close with a video that our team prepared, which I think kind of shows the spirit of Ohio and Ohioans as we move through this. People are still pushing forward. We are Ohioans. We're strong.
We've always been Ohio strong. And now, we need that strength more than ever. It's up to all of us to stay home, stay positive, and stay healthy. And even though right now we can't gather together, in Ohio, we will always stand together.
Thank you all very much. We'll see you tomorrow at 2. Thanks.
Closing video from Governor Mike DeWine and the latest update today that started with a little home ec, as Lieutenant Governor John Husted said, as Fran was up there again today.
Yeah, the First Lady giving us, last week she gave us recipes for pasta and Play-Doh, and today she's just showing us how to make a good pot of bean soup. But the message there that she had was using this time, as Dr. Amy Acton said, using this time, don't look at it as a shutdown, but an open up. Spending quality time with your loved ones.
Unfortunately, the numbers continue to rise as they anticipated. 140 more cases, 704 now in Ohio. 55 counties, that's 6 more than yesterday, 10 deaths, 182 hospitalizations, and 116 healthcare workers now infected. Adrienne Robbins has been with the governor and his team down there. She joins us now live. Adrienne?
Well, maybe one of the biggest things to come out today is obviously those updated numbers. They are shocking. Over 700 cases here in Ohio now. But one of the biggest statistics that stood out to me was the fact that 16% of our confirmed cases are healthcare workers. Now, Dr. Acton said that could be due to a couple of different things. Obviously, healthcare workers are some of the most vulnerable because they can be treating someone. They may not even know that they're sick. But at the same time, they are the most tested. So she said that these numbers could be skewed. However, she does worry about healthcare workers becoming ill and ultimately not being able to staff those hospitals. Yesterday, we talked so much about the capacity of our hospitals and the fact that they're going to need to expand that capacity, especially when it comes to the ICUs. But today, Dr. Acton said we also need people who are able to be there beside the bed, not just the bed itself. And so that's obviously a big concern for her. Another big concern continues to be those PPEs, that protective personal equipment, things like masks, gloves. We hear about it all the time, but right now the state simply does not have enough. Governor DeWine said we got our share from the federal government, and unfortunately it simply is not enough. Now, I've seen so many pictures out there, and Dr. Acton said that she had as well, of people actually making masks and donating them. And today she told those people that just because they may not be used in surgery or in those high intensity situations, they could still be used down the road. She said this is an all hands on deck scenario, and we don't know what we could end up using. So she said that they are still very much appreciated. Local for you at the State House, I'm Adrienne Robbins, NBC4.
All right, Adrienne, thank you so much. Something else that John Husted, Lieutenant Governor, talked about is, of course, the unemployment cause. And in emails or people going on the website, that unemployment.ohio.gov, the website, they checked it out yesterday. It was up and running yesterday. It's up and running right now. We've got all of that information for you there, the coronavirus website, all of the links and other information that you need on our website, NBC4i.com.
One of the most important things that he said today, we have been talking about non-essential businesses shutting down. And he said, we are starting to take action today on one business that is clearly not acting properly, and we are under the essential category. Enforcement, he says, is coming.
Yeah, and it's interesting how he said, if you don't think that we see this, one of your competitors is watching and they will report you. So shut it down before we have to enforce it like that.
All right, that's a quick wrap up of the latest that we have from the governor's office today, and we will join you shortly.
First at 4. Come on back, everybody.